Yeah. See, my research group primarily has focused on uh, cancers that have develop as a result of a virus called human papilloma virus. India has the world's largest burden of cervical cancers, which is a tumor that occurs in the opening of the uterus and is caused by this virus called human papilloma virus. So we've studied over many years the mechanisms by which the virus induces cancer. Fortunately now there is a vaccine available which can prevent infection by a few of these dangerous viruses, not all the virus. The virus has about 56 high-risk subtypes. We have a vaccine that covers the 4 most common ones and the 2 most high-risk ones, but we don't know what will happen 20 years from now, whether we can actually contain the disease, but for now there is a vaccine available. So one of our major research over the last 20 years was establishing how the virus causes cancer. The other major area which we also worked on was cancers of the oral cavity, which are highly prevalent in this country because of excessive use of chewing tobacco. Over the years, we managed to identify the different pathological and molecular pathways that cause oral cancer, but we have always been unable to find out preventive strategies. Another important area that we work on is cancers of the mouth, the oral cavity. And this is very common in our country because of the high use of chewing tobacco. While we've got a lot of information on the pathological processes and the molecular pathways that result in the development of cancers in the oral cavity, how it starts as a pre-malignant lesion and then it progresses on to invasive cancer. We've had very few very good studies that have looked at prevention of the malignancy. There is an area of research called chemoprevention, that is use of natural compounds to inhibit the progression of the disease. So once you get a pre-malignant lesion, it hasn't become cancerous yet. So if there is a way to stop it as it is or to make it go back towards normal, that would prevent a lot of morbidity and mortality and treatment costs that the individual or the government has to bear. So we've used a very popular ingredient of the Indian cuisine, turmeric. And turmeric has a bioactive compound called curcumin, which has been shown over many years in many laboratories in the lab to have very good activity. Unfortunately, there were very few clinical studies, and the primary reason being is since curcumin cannot be patented, no pharmaceutical company would be keen to do a large study. But since it is a very potent bioactive compound, we went ahead along with my colleagues at the Regional Cancer Center in Trivandrum. We did a chemopreventive study where we gave in a very rigorous, what we call a double-blind study. We treated patients with precancerous lesions in the mouth with a fixed dose of curcumin for a year. The study was unblinded about 3 months back, and it definitely has shown that curcumin works. It inhibits the progression of this pre-malignant lesion. So the critics would immediately ask, Indians eat a whole lot of turmeric every day, right? And why isn't that preventing? Because sometimes dietary turmeric may be even more than. The fact of the matter is, while that is true, our body has a unique way of completely removing that the amount of curcumin that comes out of that turmeric that we eat. The body's metabolic systems and detoxifying systems ensures that turmeric is completely cleared out. So what we would of curcumin. So what we would call in pharmacological terms, bioavailability is not there. Here we gave large amounts of purified curcumin doses, but yet when we looked at the levels in the blood, they very rapidly disappeared. But since we gave purified curcumin sustained over a year, that must be why we got the actual clinical effect. So what we now need to do is to look for methods by which you can bypass the body's metabolic systems, or find out a chemical formulation that allows it to float around in blood for much longer. Or in the case of, again, pre-malignant lesions which are highly accessible, see whether you can do a direct local delivery of curcumin into the lesion. And we have colleagues who work on nanosciences and who make interesting compounds, interesting drug carriers. And if you can do everything at the tumor site, then you can, that's the safest way to avoid the. So again, it is extremely interesting from a public health sense. It is much cheaper to prevent the cancer rather than trying to treat the cancer.
Yeah. So this is ongoing.
This is ongoing work. We've just unblinded the clinical study. The entire, there's a huge amount of data which is now being analyzed, and we hope to publish it shortly.